Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar. You're watching my YouTube channel. Today's video is on the COVID-19 vaccines, and you may have heard on the news that there have been 4 different kinds of vaccines that have been prepared so far that have shown very promising results. Please watch this video till the end, like and share this video and subscribe to my channel. As far as the vaccines go, we have heard over the last few weeks. Initially, there was the Pfizer vaccine, which showed promising results that it is 90% effective. The second one was the Moderna, which has shown 95% efficacy. And the latest has been the UK Oxford vaccine, which has shown efficacy up to 70%. However, when they notice that initial dose, if it is given in low dose and the second dose is a high dose, the efficacy could go as high as 90%. So what is and the fourth one, which is the Russian Sputnik vaccine, and they have said that it is also 90 to 95% effective. So the question is, which vaccine would be the most effective? The Pfizer vaccine is good. It has got excellent efficacy of up to 90%, but it needs to be stored in minus 70 degrees centigrade, which makes it kind of hard to be distributed, stored, especially in the underdeveloped world. Moderna vaccine is a little better. It could be stored at minus 20. It could be okay in the refrigerator for up to 24 hours. And at room temperature, it could still be good up to 10 hours. So that is good thing about the Moderna, and its efficacy is 95%. As far as what type of vaccines they are, the Moderna and Pfizer vaccine are RNA based, in which RNA, which is part of the genetic code of the COVID-19 virus, that is injected, and the body identifies it, the immune system makes antibodies against that RNA, and the cellular immunity is also activated. And when the virus comes in, both types of antibodies, any humoral response, the antibody-based immunity and the cellular immunity, both become activated and they destroy the virus. In case of the Oxford vaccine, they have made it as kind of a sublethal type of common flu virus. They have taken the protein component of the COVID virus, the spike protein, and the protein is injected and protein is identified, antibodies are prepared against it, and whenever the virus comes in, person is exposed, the immune system gets rid of it. So this is the basic difference in between the two vaccines, three common vaccines. The other thing is the cost. We know that these vaccines have to be distributed all over the world. So the rich countries can, of course, afford it. But the Oxford vaccine is only 3 pounds, British pounds, which compared to the Pfizer, which is 15 pounds, and Moderna is up to 25 pounds in terms of the British pounds. And they would be, be more cost effective if this Oxford vaccine is utilized based on their recommendation that initial dose should be low and the second dose should be high, and the efficacy and effectiveness could be increased up to 90% in those cases. So that would be really, really nice for India, Pakistan, and underdeveloped world. While in US, we have Moderna vaccine as well as the Pfizer. The Pfizer vaccine, there is a meeting of FDA on 11th of December in which it's likely going to get approved. for vaccination of high-risk people. And the high-risk people are, the first line of defense is the physicians and healthcare providers, and then we have military, and then it would be high-risk people and general population. At this time, institutions are not making it mandatory because it's still an experimental vaccine. So they don't want to make it a mandatory vaccine, not completely knowing the long-term side effects of vaccines. And of course, like any other medications, the phase 1, phase 2, and phase 3 trials are initial ones. And then phase 4 are the post-marketing surveillance, in which you monitor the side effects of a medication or vaccine after it is being administered on a population basis. So these are the common vaccines, and they are actively preparing millions of doses, because remember, these doses have to be distributed all over the world. So Oxford vaccine is already making millions of doses, same is with the Pfizer as well as the Moderna, and likely chances that Moderna vaccine would be approved sometime later next month as well. So we can anticipate either later next month, which is December, or early January, the vaccination will be started. And we hope that by the end of the spring, most people get vaccinated. And it will depend, usually, of course, the cost is high. The developed world would be getting immunized first, and then later on the underdeveloped world. And I know that the Russians, they say it's 95% effective. China is also making a vaccine, and the phase 3 clinical trials are also taking place in Pakistan. So hopefully the people will have back home in Pakistan or India. India is also making vaccines. They will have some kind of vaccine by this summer to be given to the masses. So let's hope for the best, that if these vaccines, they prove really good. And people ask me what is my recommendation. So I say, if it starts, the charity begins from home. So as far as I'm concerned, I'm going to get the vaccine and make sure my family also gets it. And then every individual has to take their own preference, have to decide for themselves. But I think at this time, this is the best option for us to prevent the illness, is to get vaccinated. As for decades, vaccines have proven effective in preventing the illnesses. Hope this video was useful for you all. Please like and share this video and subscribe to my channel. May God bless us all and protect us and our families from this deadly virus. And all those people who are affected by this virus, may God give them speedy recovery, health, and happiness. Ameen. Sallallahu alayhi wa alihi wa sahbihi wa sallamu taslima. Thank you.